this lesson, we'll finish our discussion of arthrology by taking a look at four specific joints in the body. We'll take a look at the two joints in the upper limb, the shoulder and the elbow, and then we'll finish up the lesson by taking a look at the hip joint and the knee joint. So let's start with the shoulder joint first. Just to review a little bit of the anatomy, we could see here is the head of the humerus, or the humeral head. This here would be the glenoid cavity. This is the socket. And if you notice, this is a synovial joint. There's a space there. And we can see the red line is the synovial membrane. That's going to produce the fluid. We also have the scapula and anterior view. This bone here that looks like a bent finger is the coracoid process. And then the high point of the shoulder is formed by the acromion process. This is coming to the high point of the shoulder from the back of the shoulder blade to the high point of the shoulder. This is the acromion. And then here we can see the clavicle, the collarbone, right above the scapula. So let's take a look at some of the ligaments. The first ligament I have for you is called acromioclavicular ligament. The ligament tells you where it's going from the acromion over to the clavicle, acromioclavicular. In medicine, we sometimes call this the AC ligament, the AC ligament. This is injured a lot of times during sports injuries or even occupational injuries. When this rips, this is actually what we call a separated shoulder. You don't need to know that from me, but just from a pathology point of view, this is where a separated shoulder would be. The next ligament is called the coracoclavicular ligament. So this is going from the coracoid process up to the clavicle. So what this is going to do, this is going to stabilize the clavicle. It'll keep the clavicle from riding up too high. The third ligament I have for you is an actual scapular ligament. This is going from one part of the scapula to another part of the scapula. Notice it's going from the coracoid process up to the acromion process. So we sometimes call this a scapular ligament because it's just going from one part of the scapula to another. And this is stabilizing, the bursa inside the joint right here. The bursa helps to lubricate the joint and makes our movement nice and smooth. The next ligament goes from the coracoid process over to the humerus. This is called the coracohumeral ligament. Now this is going to support and stabilize the superior aspect of the shoulder joint. And then finally, going from the glenoid cavity, which is like underneath in here, over to the front of the humerus would be the glenohumeral ligaments, right? Going from the glenoid cavity over to the humerus. These are going to also support the anterior aspect of the shoulder. So here's one of the models that we have in the lab where we can see some of these ligaments. So let's start with up here. Let's start with the acromioclavicular. So here's your acromion process. Here's the clavicle, and that's the ligament right in between. Like I said, we sometimes call that the AC ligament, and this is where we would have a separated shoulder. The coracoclavicular go from the coracoid process up to the clavicle. So this is going to help to stabilize the clavicle. And the third ligament that we see on this model is the scapular ligament. That's going to go from the coracoid process over to the acromion, right? Coracoid to the acromion right there. And it's stabilizing the top of the shoulder. Some of the other things we see, we don't know yet. We're going to learn this when we do the second module on muscles. This is the long head of the biceps, and then this is the supraspinatus muscle. You don't really need to know that for the arthrology part. We're going to talk more about that when we actually do the muscles. I'd rather you focus right now on the actual ligaments. Okay, so that finishes up our shoulder joint. Let's take a look at the elbow. So the elbow anatomy, just as a review, is an articulation between the humerus above, right, proximal, and then the radius and the ulna, more distal. This represents the condyle, and we know that the condyle is broken down into two parts. The capitulum, and that articulates with the head of the radius. Here is the trochlea, and that articulates with the trochlear notch of the ulna. And we know from a previous lesson, this is a nice synovial joint. That's a hinge joint. So let's take a look at some of the ligaments here. So this is an outside view, a lateral view of the elbow joint. This triangular ligament right here is known as the radial collateral ligament. We could also call it the lateral collateral ligament because it's on the outside of the joint, and that's exactly what it's stabilizing, the lateral aspect of the elbow joint. Now, if we turn the elbow around and we look at it from the inside, I know it's an inside view because I see the ulna first, right? The ulna is the more medial bone. There's a ligament that comes from the humerus right over to the ulna here, all of this. This is the medial collateral ligament, or we could call it the ulnar collateral ligament. Either one would be correct. And this is also stabilizing the inside of the elbow joint. The third and last ligament of the elbow that I'd like you to know is the annular ligament. This is kind of a circular ligament that actually goes over the head of the radius. So here's our radius. Up here would be the head of the radius, and that's what's rotating right here on the capitulum. So this ligament covers the head of the radius like that. Now, as we pronate and supinate our forearm, the radius rotates over the ulna. Well, that radial head is rotating on the capitulum, and this ligament stabilizes that radial head. It's holding the radial head in place. Okay, so that's our just three ligaments that I'd like you to know for the elbow joint. Let's move down to the lower limb now and take a look at the hip joint. So what we're looking at first, this is the cup that the femoral head fits into. This is known as the acetabulum. And you can see here it's lined by cartilage. There's even a little fat pad inside there. So this is the big round cup that the femoral head is going to sit in. Now when we look at an anterior view of the hip joint, the femoral head now is in the socket. Let's take a look at two ligaments that are in the front of the hip joint. The first one comes from the ilium down to the femur. You could follow it here. Look at this one right there. And then it also kind of splits over here. This is called the iliofemoral ligament. Iliofemoral. We sometimes call this the Y ligament because it kind of looks like a little bit of a letter Y like that. Then coming from the pubic bone over to the femur here, this is going to be the pubofemoral ligament. Both of these ligaments stabilize the anterior aspect of the femur. Now here it is on our model. So again, coming from the ilium is the iliofemoral ligament like that, here and here. That's the Y ligament. And then coming from the pubic bone, I labeled that for you right here. Here's your pubic bone. Coming from the pubic bone, all of this is going to be your pubofemoral ligament. Now this is a posterior view of the hip joint, so we're looking at things from the back. Again, here would be some of the bottom part of the ilium, and then all of this is the ischium, right? Here's the ischial tuberosity that we sit on. So there's one ligament that I want you to know back here. It's pretty big. It's called the ischiofemoral ligament. All of this is supporting or stabilizing the back or posterior aspect of the hip joint. Ischiofemoral ligament. Here it is on our models, and I tried to do the same kind of view. So again, this is all coming from the ischium over to the femur. All right, we can see a little bit of the iliofemoral ligament. This one, when you're in the lab and you turn it around, you'll see this one goes to the front of the femur. That's the one that we just did. But on this slide here, I want you to focus on the ischiofemoral ligament. Okay, so that brings us to the last joint, which is going to be the knee joint. So this is an anterior view of the knee joint. We could see here, just to give you a little bit of bearings, but up here would be the femur coming down. Here's the kneecap or the patella, the tibia, and then on the lateral side, the fibula. So when we study the muscles in the next module, the quadricep muscles on the front of our femur, they come down. Here's the tendon of the quadriceps, and that goes to the patella, and then that tendon continues down as a ligament known as the patellar ligament. So above the patella, this is the quadriceps tendon. It's continuous, it continues down, and then we call it the patellar ligament, which attaches to the tibial tuberosity. That big rump bump right there is the tibial tuberosity. Okay, so quadriceps tendon, patellar ligament. Now, there's two stabilizing ligaments on the inside and outside of the knee. Let's do the inside first. This little strip right here, this is the medial collateral ligament. That is also known as the tibial collateral ligament because it goes from the femur to the tibia. And then out here is the lateral collateral ligament, also known as the fibular or fibula collateral ligament. Again, guys, remember that the fibula is always on the outside, the lateral side. So you can use that for your bearings, right? You always want to make sure that you know medial from lateral. So I always look at the fibula to tell me, okay, that's the lateral aspect of the knee joint. All right, so both of these, the medial and the lateral collaterals, they stabilize the knee joint, right? Medially and laterally. This is a posterior view of the knee now. There's one ligament that I'd like you to know inside the knee here. It runs obliquely, kind of down at an angle. This is called the popliteal ligament, all of this here. And this is going to stabilize the back of the knee. Popliteal means the back of the knee. So here's an anterior view of the knee, just a couple more ligaments I want to show you. Inside the knee, there are two ligaments that cross. We call them the cruciates. This front one, this is a front view, so this front one here is the anterior cruciate ligament, the ACL, and then the right behind it there crossing, you can see a little bit, that is the PCL, the posterior cruciate ligament. They're going to stabilize the movement of the tibia on the femur, so the tibia doesn't slide forward and backwards too much. And then also on this picture here, on this diagram, see two fibrocartilage discs known as the meniscus. Right, on the medial side, this is the medial meniscus. Right, so this is a cushion between the medial femoral condyle here and the medial tibial condyle here. And then over here is the lateral meniscus. So that would be a cushion between the lateral condyle of the femur and the lateral condyle of the tibia. So these menisci sometimes become torn, and people have to get arthroscopic surgery to have them repaired. Okay, so here they are, the ligaments that we just looked at on the model. So again, coming down, this is the quadriceps tendon. The patella would be under here. We don't see it, but continuous with the quadriceps tendon. Now we're going to change the name patellar ligament, right? And it's going to the tibial tuberosity down over here. We could see the collateral ligaments, medial collateral ligament out here, lateral collateral ligament. Right, they stabilize the outside of the knee and the inside of the knee. And then we have an anterior view of the medial meniscus, anterior view of the lateral meniscus. Again, I can't stress enough, make sure you know your medial and your lateral. Fibula is lateral. And then here's our last slide. So again, just a posterior view of the knee. Again, medial collateral ligament here on the inside of the knee, lateral collateral here. We could see lateral meniscus, medial meniscus, and then finally, guys, here's our cruciates. So now this time, this is the posterior cruciate because this is a posterior view of the knee right there, and then this is the anterior cruciate in front of it. Okay, so that concludes our lessons on arthrology. And again, in this lesson, we focused on the ligaments of the shoulder, the knee, the hip, and the elbow.